The next scenario has to do with confidentiality and privacy. This one, I'm sure many people can relate to at some point, and if it's not in the hospital, then maybe in their personal lives. So the scenario goes: a nurse discovers that a prominent public figure has been admitted to the hospital for a sensitive medical issue. The nurse faces pressure from the media and public to disclose the patient's condition, but doing so would breach patient confidentiality. How can the nurse uphold patient privacy and confidentiality in the face of external pressures? So this is an interesting scenario because this specific one I've not personally dealt with, but when I used to work in Santa Monica, it was a more prominent hospital that some famous people go to. They've been there, and some of the nurses that have been working there for years, they told me a handful of scenarios where there'd be somebody famous in there. Maybe it was for surgery, or there was a few times where they would be admitted to the psych unit, and the patients were famous. So they told me that when they came out of work, there was news stations there, and there would be reporters come up to nurses and asking, "Hey, have you dealt with this patient? Is this patient here? Is it true that so and so is here? What's going on?" And the nurses actually told me a really good thing to say if that happens to you, and that's basically, don't disclose that they're there. Don't say that, yeah, they're here, but I don't know anything about them, because technically then you're still giving away information. All you have to say is you're not sure, you just work on your unit, and you're not sure where the patients are around. So try to not give out any kind of information, because even saying that, yeah, they're there, but I haven't worked with them, I can't answer any of your questions, you're already giving them some kind of information. You're already telling them that the patient is there. So when it comes to somebody famous being in the hospital, just try and disregard it as you don't know if they're there, and you don't know why they're there, so on and so forth. That kind of stuff. Just be as vague as possible. Just don't give any kind of hints to anything. But with this whole privacy and confidentiality thing, what has happened to me a handful of times, and this is a little bit of a more popular scenario, is when there is a patient in the hospital and you have family calling that maybe don't know the password or aren't on the list. So technically, you can't give them any kind of information. And this is a little tricky because when some nurses are asked if this patient is here and they ask for a password, and the person that's calling doesn't know the information, sometimes they go back and say that we're not even sure this patient is here or something like that, or sometimes they don't even disclose that they are there, because sometimes let's say I had this one time where I had a person in the hospital, and this person said that the people that I want calling me, they're going to call and they're going to tell you the password first. And if they don't tell you the password first, then don't even tell them that I'm here. Which basically means that a person would call and they would say, "Hey, Steven Smith is here, password is Lily's." And that's when I knew that, hey, okay, this person I talked to, versus like somebody else calling that would be like, "Hey, is so and so here?" I'd be like, "I'm not sure. I could look more of that into. Do they maybe have a password? Maybe I could find them with a password if you have their password." And they'd be like, "No, I don't tell me about a password." And I could be like, "I'm not sure if the patient is there. Can you maybe call a family and maybe giving the password?" That kind of stuff. You kind of try to beat around the bush. You're not giving away any kind of information, because the patient made it specifically clear that when someone's going to call the unit, they're going to introduce themselves and they're going to ask if they're there and also give the password. So I already knew that this person didn't give me the password off the bat, because that's what they were told to do. And then when I asked again if they could give me some clues that could help find them, they didn't know it either. So at that point, I had to say that I'm not sure if he's there. I'm sorry. Maybe you could call another family member. Maybe they're at a different hospital. So you have to kind of play around with this, because sometimes the patient might tell you, "Hey, whoever calls, just give them all the information." And then when everybody calls, you give them all the information. But if a patient usually tells me that to tell anybody who calls the information, usually I'm a little bit still hesitant. I'm like, maybe you just set up a password just in case somebody calls that maybe you don't want knowing their information, maybe your boss or something like that. And then that makes them think twice, because they may first think about just their primary family, or they're going to call, just let them know whatever they want to know. But I want to also let them know that, hey, anybody could call. And if you tell me that I could give anybody this information, then I'm going to give anybody this information. So let me at least have you understand what that really means and give you like a second option just in case, because you never know, a coworker might call, and because you're not really thinking about your coworkers or your boss or your manager when you're in the hospital, right? You're thinking more of your family because that's your main concern. And if you tell them that, hey, but if your boss calls, I'll tell them. So then it makes them think twice. Or there's like, okay, maybe I will just give you a password, okay, and so on and so forth. Or they could say, if somebody calls, can you come back and tell me who's calling, and so on and so forth. So that's how I like to deal with that privacy and confidentiality ethical dilemma.